11,000 Americans will die waiting for transplants this year. In the meantime, the Medicare program is putting people who are lucky enough to have a kidney transplant at risk by cutting off their coverage. Why do you think this has gone on for 50 years?
A kidney transplant is an investment that the government makes into the patient's future. Unfortunately, that investment is lost, and the patient's health will take a turn for the worse if they cannot get their immunosuppressive drugs.
These patients were often forced to wait on a list for years behind thousands of people before finally receiving a life-saving transplant. However, many patients were frightened by what came next. Medicare only provided immunosuppressant drug coverage to most patients for 36 months.
Removing the 36-month cap on Medicare coverage for immunosuppressant drugs seemed like a no-brainer policy, but because of some budget rules and scoring from the Congressional Budget Office, it took a little while for people to open their eyes and also recognize the cost savings.
So after years, literally a decade of wrestling with the policy, a light finally shone over at the Congressional Budget Office, and they confirmed what others have known all along, that this delivers savings to Medicare.
It was interesting to watch this campaign develop. I mean, we've been around since 1987, so we've been here through the earlier campaigns and had the frustration of not being successful. I must admit, over the past year, there's been times I said, can this one be different? And I felt it could be.
Coming up, we're talking about Honor the Gift, guys.
Yeah, it's a campaign to protect the gift of life by removing Medicare's 3-year limitations on annual rejection reimbursement.
The campaign was purposely designed to bring more people to that appreciation, to bring more people to the table, and to really to empower transplant patients to be able to use their voice in conjunction with the general community, because we recognize that this is a societal issue.
I feel like people had just given up on it ever happening, that it just wasn't going to ever get passed, so why put in the effort and the work? So I think CareDx really stepping up and saying, no, this is important to patients, and kind of, leading and paving the way, I think really made a huge difference.
Before I came to Congress, I really thought that Congress was a proactive institution. It's not, it's reactive. And so advocacy, the push from the outside, I think I know what to do on the inside, but the push from the outside is absolutely essential.
The passion that was there from CareDx and the Honor the Gift staff and all of the advocates that were involved, I just knew it was gonna pass. And so when it did in December, I was like, it just was just so excited.
More than anything, my first thought was, oh my God, I was a part of actual change. And to be able to say that I was a part of this amazing group of patients, clinicians, organizations, friends, family that enacted actual change for future generations to not have a battle that they have to fight is honestly, if that's the one thing I accomplish in my life, I'll be happy.
It will be such a relief for all of us to know that if something is to happen, we have something to fall back on to protect us and to protect this precious gift that we received either from a living or deceased donor.
So not only do we save lives, not only do we improve health outcomes, but it's also a better bargain for the taxpayer. You can't get better than that when it comes to healthcare reform.
Advocacy works, but the best form of advocacy that I've found throughout the years are those individual patients sharing their stories about what's happening to them with the status quo and what can change in their lives if we can adopt policy that makes better sense for them.
I want to thank the Honor the Gift Coalition's tireless advocacy in support of this legislation. Kidney recipients in Illinois and across the United States can rest assured knowing that you're looking out for them. I'm proud to have worked alongside you, and I'll continue to work to support your efforts for kidney disease patients in Illinois and across the nation.
Thank you so much for honoring the gift. This means so much to me and all transplant recipients and transplant recipients to be.